performing a cystocentesis on a female dog right now, so I'm going to be aspirating into the bladder to get a urinary sample before her procedure. I've got my supplies right here. I've got a 12 ml syringe and a 22 gauge needle, 1.5 inches long. This is what I'm going to tap the bladder with. And then I've got our vacuum that we're going to put the sample in after we're done. And then I've got alcohol and some scrub here to clean the site before I puncture. So we're going to lay her in dorsal recumbency, so on her back. And I'm going to take alcohol and clean the site where the bladder is at. So if we can slide her that way a little bit further and stretch out her back feet a little more. Perfect. Making sure our little area is clean, so we're not introducing any bacteria. And then I'm just going to feel with my hand so I can tell where the bladder is. So you can palpate the bladder right here. It's about the size of a small egg. So I can poke my needle in right there. So I'm going to break the seal on my syringe before I poke. And then I'm going to poke straight down without aspirating back at all till it's in place. And then I'll aspirate back to see if we have the urine sample. Okay, you ready? So straight down. I'm going to draw back. See that we have our urine sample. And draw what we need. We need a minimum of 2 mils for our test that we're running. So there, we've got 4, so that should give us enough extra. I'm going to release pressure on the syringe and then just pull straight out. Good girl. Okay, so she can sit up if that's easier. And then I'm just going to put it directly into my vacutainer and let the vacuum seal pull it in. I'm not putting any pressure on it. And then label my sample. If we're not going to run it immediately, we'll put it in the fridge. Otherwise, we can go ahead and run this urinalysis right away. So I'm labeling it with the patient information, client name, and the date. Okay, and then we have our sample obtained by cystocentesis.